Hello everyone. This topic is on diseases in population. The learning outcomes of this topic are for the students to define epidemiological terms, incidence and prevalence, morbidity and mortality, as well as diseases in population. What is epidemiology? Epidemiology is the study of factors and mechanisms in the spread of diseases in a population. By definition, epidemiology is the study using scientific, systematic, and data-driven of the distribution, which are the frequency or pattern, and the determinants, which are the causes and the risk factors of the disease in a specified populations, which are the neighborhood, school, city, state, country, or global. So in epidemiology, prevalence and incidence are among the most fundamental measures when it comes to monitoring diseases. But do you know what they mean or how and why they are so important? Well, incidence and prevalence are frequently confused. Incidence refers to the number of new cases that develop within a given time period. Incidence is an indicator of the spread of disease. Prevalence is the number of people infected at any one time. The prevalence of a disease refers to the proportion of individuals in a population that have a disease at a particular time. It is therefore a measure of the disease burden. Prevalence takes into account both old and new cases. It is an indicator of how seriously and how long a disease affects a population. When thought of like a bathtub, incidence is the water being added to the bathtub. Prevalence is the contents of the bathtub, and cases that recover or die are the water leaving the bathtub via evaporation or down the drain, as represented in the diagram. Mortality rate and morbidity rate. Mortality rate is the number of deaths as a proportion of the population. It is often expressed in the unit of per thousand individuals per year. Morbidity rate is the number of cases as a proportion of the population. A morbidity rate is the rate at which acute and chronic diseases occur in a population. Morbidity rates can be used to determine the overall health of a population and to determine the healthcare needs. Frequency of occurrence is a criterion that is used in the classification of diseases. Diseases in populations are classified as endemic, epidemic, pandemic, or sporadic. If a particular disease occurs only occasionally, it is called sporadic diseases. It is random and unpredictable manner which involve several isolated cases that pose no great threat to the population as a whole. For example, typhoid fever and rabies. For epidemic disease, the term refers to the many cases of disease appear in a population and patients are sufficiently harmed to create a public health problem. If many people in a given area acquire a certain disease in a relatively short period, it is called an epidemic disease. It is an outbreak of disease that attacks many people at about the same time and may spread through one or several communities. Examples of epidemic diseases include influenza, leptospirosis, Japanese encephalitis, malaria, and COVID-19. Pandemic disease. It is an epidemic disease that has spread over an exceptionally wide geographic area or several geographic areas, which happen throughout the world. Well, we can say that more than 2 regions or countries are affected by the disease. For example, MERS-CoV, Ebola, influenza, chikungunya, and COVID-19. We experience pandemics in influenza from time to time. Some authorities also consider AIDS to be pandemic. The world now is having pandemic of COVID-19 and is still battling of the disease. If an infectious agent is present continually in the population of a particular geographic area, it is an endemic disease, with both the number of reported cases and the severity of the disease remain too low to constitute a public health problem. Well, the disease exists permanently in a particular region or population. For example of endemic disease include common cold, chickenpox, as well as measles.